That's right. So good evening and welcome everyone to this evening's lecture, our first of 2022. And we're very fortunate to have Professor Frank Kelly with us this evening. Professor Kelly holds the chair in Community Health and Policy at Imperial College London, where he's director of the Environmental Research Group and director of the NIHR Health Protection Research Unit on environmental exposures and health. It's no exaggeration to state that Professor Kelly has been a pioneering figure in making society aware to the problems caused by air pollution. Professor Kelly leads a substantial research program at Imperial, which spans all aspects of air pollution research from toxicology to science policy. His experimental research has examined the toxicity of airborne particulate matter, diesel and biodiesel exhaust emissions, wood smoke, and has identified biomarkers of exposure. A new area of investigation is ambient microplastics, where his work is focusing on the identification, detection, and potential health effects. Professor Kelly has published over 380 peer-reviewed papers, as well as many conference papers and books on the toxicology and health effects of ozone, nitrogen dioxide, and particulate pollution. In addition to his academic work, Professor Kelly has provided policy support to the Greater London Authority and the World Health Organization on air pollution issues. He is recent past chair of the UK's Department of Health and Social Care Expert Committee on the medical effects of air pollutants, and he is a member of the Health Effects Institute Review Committee. Frank, is very fortunate that we have you here this evening. Thank you very much indeed. I'd just like to quickly remind everyone that if you have any questions for Professor Kelly this evening, please post them in the Q&A, and we'll come to those questions at the end of this evening's session. Over to you, Frank.
Thank you very much, James, for that wonderful introduction. Let me just get my talk up on the screen. Maybe you can confirm when you can see it.
Not yet, Frank.
Can you see it yet?
No, sorry. Something's happening. There we go. You might want to go to full screen as well, Frank, I think.
Hopefully it's coming.
Yeah, we're all set. Great, thank you.
Great. So again, thank you very much for that introduction, James, and good evening, everyone. It's a pleasure to be able to come and discuss this important topic with you tonight. What I'd like to do to the talk is actually split it in two. So the first part, I'm going to talk about the top line of this title, the air pollution and public health impacts. And then once we have gone through that, then let's look at how the UK is doing now that we've had Brexit and we're outside the EU, where our air quality regulations used to come from, but they don't anymore. So starting off with the health effects, apologies, but this is something pretty obvious. I don't think any of us would accept to drink dirty water. I don't think any of us would eat that bread, because we know it would harm our health. So the big question really is, why should we accept breathing dirty air? And for a long time now, this has been the case, that the air that we are breathing, particularly in towns and cities, is not fit for consumption. And to put this into context, if you just think about the things that we do to actually maintain life, we eat, we drink, and we breathe. And if we put that on a weighted basis, then this pie chart explains that this is the weight of food that we eat each day. This is the weight of liquid that we consume each day. And the rest of this is the air that we breathe. It's a massive amount of material which goes into our body. And you can just imagine, if that air is contaminated, then that's a lot of access to pollutants which is entering our body from this vital route of breathing to provide us with the oxygen that we need to live. So that's the situation. It's something which we don't think about. You know, we all breathe without concentrating on it unless we're out of breath because of exercise or we've got a lung problem. But this entity is really, really important, and therefore the quality of the air that we breathe in is also really, really important. So that's the starting situation. So let's think about the effects that poor air quality can have on health. And the way I think it's best to think about this is there are both short-term effects and long-term effects. The short-term effects tend to be seen in individuals who have got an existing health problem, especially a respiratory problem such as asthma. And so when we have an air pollution episode, and we have many of these during the year, they happen for a day or two at a time because of either changing atmospheric conditions or something's happened in the in society, such as the spraying of fertilizers in agriculture, leads to air pollution episodes. And in fact, my team today has just released a warning for London for a moderate air pollution period tomorrow, which is a combination of the meteorology that we're seeing at the moment, which will mean that a lot of the pollution won't escape from the city and it'll just build up. But on days like that, if an individual has got an existing condition, a respiratory condition, a cardiovascular condition, then they may find that they have more difficulties breathing. And in some cases, that difficulty is such that they're even taking increased medication doesn't relieve those symptoms. And that is when they end up having to require medical help. And let's just look at that. So what's the evidence then for these short-term health effects? So what we did was we requested information from the UK Ambulance Service. This was a study back in 2018. It's in springtime because that's when we tend to have major air pollution episodes during the spring and in late autumn and winter. So we're just experiencing some of those at the moment. So when we asked for their data, we find that whenever there was a first episode of air pollution in April 2018, there was 1,200 additional hospital consultations linked to that episode. And then a few weeks later, there was another episode which actually lasted for several days. I think it was 4 days in the end. And as a result of that, there was 2,300 additional hospital consultations above and beyond what they would have expected at that time. And that was related mainly to respiratory and cardiovascular conditions. And it's very likely that these additional consultations would not have been required if there had not been poor air quality. So that's the sort of evidence that we have to suggest that, yes, if you've got an existing condition, then if air quality goes to moderate or severe, then you're probably likely to have a requirement for increased medical attention. If we now think about the long-term health effects, and here we're not just thinking about an air pollution episode, but we're thinking about breathing in reasonably impure air over many years and sometimes decades. And what we're talking about here is that contribution to the development of a disease, not the exacerbation of it, making it worse, but actually causing it in the first place. And here, the evidence, which is now very, very secure indeed, suggests that every year we have 7 million additional premature deaths due to exposure to both outdoor and household air pollution. Now, the vast majority of these are in Asia and overseas from the UK, but certainly in the UK, we still have a substantial number, probably the order of about 30,000 every year now, which is related to poor air quality. And these people are dying because of either respiratory conditions or circulatory problems such as heart disease or stroke. There are other problems as well, but these are the ones that dominate. And there is now evidence from, every continent across the world that this is a situation that where air quality is poor, then you're going to have more people dying at a younger age because of the development of some of these conditions. So that's the sort of long-term health effects. If we go to other statistics which are now available through projects like the Global Burden of Disease, this is 2019 data, you can see that after these top 3 risks, and that's poor diet, cancer development, or tobacco smoking, then air pollution comes forth on the major list of risks to death or to early death. And the calculation from this project was that across the world, people are dying roughly 20 months earlier than they should be because of the quality of the air that they're breathing. And a lot of that early death is due to outdoor pollution, which we call ambient, and it's due to ambient particle pollution. And I'll explain that in a little bit more detail shortly. And that's responsible for about 1 year out of the 1 year, 8 months. And then the household air pollution exposure is responsible for about another, on average, 9 months. So both what you're breathing outdoors and what you're breathing indoors clearly can have a big impact on your health over a reasonably long period of time. So I've talked about early death and the numbers involved in that, but in reality, this WHO diagram illustrates very well, I think, that that number, it sits really at the top of a pyramid. And as we go down through this pyramid, then the numbers that are affected or involved or implicated is much, much greater. So yes, there's a lot of people dying, 7 million we think early, but beyond that, there's a lot more people who actually are ending up in hospital or attending A&E or having to visit their doctors. And many of those visits require them then to have increased medication because of the symptoms that they're suffering. And then below that, one of the major symptoms, one of the first ones is clearly an impact on your lung, because that's where the first impact of the pollution is. And so there are people having impaired lung function. This you may not even realize until you maybe try to exercise or just push your body a little bit further than you normally do. And then for all of us, there is unfortunately these subclinical effects, and that really affects the whole population depending on how much pollution they're being exposed to. So there's this terrible pyramid of effects with only death sitting at the very top of it. So air pollution really is affecting, our life and the way we live in either ways we don't realize or in very obvious ways as we age. And if you're interested in more information on this, obviously I can only give you so much in this discussion. You should look at this report from the Royal College of Physicians and the Royal College of Pediatrics and Child Health. It was published back in 2016, but it really summarizes very well, I think, the impact of the air pollution on our health across the life course. So we used to think that just air pollution affected our lungs and was maybe associated with diseases like asthma or chronic obstructive pulmonary disease, but now it's quite clear that it has an impact even before we're born. So it has impacts on during pregnancy, and we know where women are in areas where there are very high pollution concentrations, such as in Asia, some parts of the Middle East, then there may be effects on the growing child. And that child may be born with a lower birth weight, they may be born prematurely, they may be born with smaller organs than they should do. And that's simply because the mother has been breathing in too much pollution. There are also clear effects on young children as they're growing up. There's developmental problems, Children often develop wheezing whenever they're exposed to too much pollution, and obviously more coughs, etc. And these may resolve in time, or they may stay with the child as it goes into adolescence. And we're now pretty clear, and I'll show you some data later on, that there is an impact on lung function and lung development. There's an impact on both the development of asthma and the severity of asthma in many children. And even there is evidence that there is the start, even in teenage years, of this process called atherosclerosis, which is the damage of our blood vessels, which end up in later life contributing to heart disease. In adulthood, we have a whole range of conditions, you know, from lung cancer right through to type 2 diabetes, that's now linked to poor air quality. And even in old age, we have the impacts as well. And some of these, which are becoming major issues in the elderly, such as poor cognition, the development of Parkinson's and Alzheimer's diseases, etc. So it's a really good read if you're interested in it, and I highly recommend it to you. So let's now think about, I've been talking about the air pollution, but let's think about what that actually means. So here on the left, we have a monograph. It's the Air Quality Guidelines, a global update from the WHO, where we get all the synthesis of the information of the impact of air pollution on health. This was the 2005 update, and it was recently updated just a few months ago, and I'll take you into that towards the end of the talk. But in it, it looks at 4 types of pollution. First of all, particles or particulate matter, and these come in various sizes. We call them PM for particulate matter, and they may be 10, PM10, which means they're less than 10 microns in diameter. They may be PM2.5, less than 2.5 microns in diameter, or they may be very, very, very small nanoparticles or ultrafine particles. And then we have these gases, nitrogen dioxide, ozone, sulfur dioxide. So all of these, there is health related impacts. The strongest evidence exists for particulate matter exposure, and that's partly because an awful lot of the work has been done in North America, where they don't have a particular problem with a gas like nitrogen dioxide, such as we have in the UK and Europe. And that's, in my mind, that's why the strongest evidence exists over here. But these other gases are also have negative effects. But let's think about the particles to begin with and putting them into context. So if I take out one of these, a human hair, I can just about see it. You probably can't on my camera, but it's on average, it's about 60 micrometers in diameter. So that means for a PM10 particle, we could get 6 of them across the diameter of a human hair, which you can hardly see. If we take a PM2.5 particle, then you can get 24 of those across a human hair. And I'm saying this to illustrate that they're basically invisible. So these particles are present in the air through combustion processes, etc., but we can't see them. But what it means is that when we breathe them in to our lungs, these can travel deep into our airways, into our large airways or small airways, and these small PM2.5 ones can get right down into the deep lung. And that's why we think they are particularly risky for our health. And it's part of the problem. The pollution is generally invisible, and that's why we really don't think about it, and we generally don't worry about it. So where's it coming from? Well, we're exposed to a whole range of sources of particulate pollution. The most obvious one, I guess, is traffic, because we know that fossil fuel combustion leads to the generation of particle emissions, leads to the generation of NO2 emissions, especially if it's diesel fuel that we're combusting. Power stations, if they're burning coal, if they're burning fossil fuels, even if they're burning natural gas, will have emissions of pollution. Agriculture, something people don't normally think of, but They produce, we use a lot of fertilizers now in modern agriculture, and these fertilizers are ammonia-based. That ammonia will often end up back in the atmosphere, in the air. You'll get atmospheric chemistry occurring. You'll get ammonium nitrate forming, which ends up being a particle. So particles from these sources we call primary particles. Particles from this sort of source we call secondary particles. But they're all important in respect of contaminating our air and having health impacts. There are other sources such as shipping. Clearly anything that moves needs power, needs probably combustion of fossil fuels. Our train systems, our underground systems, and even firework displays ends up polluting our air. Not a massive problem in the UK because we have very restricted occasions when we have fireworks. But if you take somewhere like India, where they have Diwali, which runs over a whole week, and it's so popular, so intense, then this can really contribute to poor air quality in cities across India. But what we're going to concentrate more on tonight is what we experience, and that is obviously particles coming from traffic emissions. So how does traffic pollution lead to so many health issues? What's the evidence behind this? I mean, when I sort of started working in this area, my team did, we were very interested in coming up with evidence which proved the link between breathing these types of pollutants and the health impacts which we associated with traffic. So where is the evidence? Well, the first thing I just should point out to you, and it's always amazing to me when I think about it, and that is just how traffic has grown even within one generation. So this is a graph which illustrates the growth of traffic travel. It's showing you annual vehicle distance traveled in billion of kilometers per year, starting back here in 1950 and going forward to 2014. And you can see there's a dramatic increase in traffic travel, and thus traffic emissions, going from what, about 50 billion kilometers traveled back here to somewhere like 450 billion kilometers traveled per year over here. And it just keeps growing. So that has been an enormous, what is a 9-fold, 10-fold increase in a generation. And a lot of that traffic growth, as you can see, is in the cars and taxis, which of course they're a common sight now, and they're commonplace to many families. In fact, many have more than one vehicle. But this is something which wasn't present, a generation ago. So the first thing is the emission of traffic pollutants has grown tremendously in our lifetime. And if we look at some of the epidemiological evidence, and this is where we look at populations, cohorts that have been sort of brought together and questions asked about their health. This is a very interesting study. It came out of Germany, you can see 14 years ago. And what they were looking at was the risk of individuals having coronary artery calcification. This basically means that the arteries are being blocked by the deposition of calcification in the center of the arteries, and this means that the artery lumen is restricted, and the bottom line is that means that artery cannot carry as much blood anymore. So this is a coronary artery, which means it's supplying the heart, which means that when that heart needs more oxygen, needs to be delivered by blood, it's got a restricted ability to do that. And what this study found was that if people lived increasingly closer to busy main routes, they had an increased risk, and quite a dramatic one. You can see here, if they lived within 50 meters of a main road, they had a dramatic increase, about a 1.6, 1.7-fold increase in having coronary artery calcification. So when we have evidence like this, it's really important to try and understand why that is happening. Not just it's there, why it's happening, and what we can do about it. If the only thing that we can do about it is to make sure that those emissions are aren't there anymore, people aren't getting exposure, then you can imagine how that would change society. If we can understand maybe some of the mechanisms behind this, then maybe there's some treatments or some other approaches or policies that can be introduced. So that was a big question for my team from an early point of view. And so what we wanted to do was we wanted to look at what happened inside people's lungs when they breathed in traffic pollution. We weren't able to do that in the UK at the time because there wasn't any what we call human exposure facilities, but we ended up finding some really good ones at the University of Umeå, which is in very northern part of Sweden, where the air is actually very clean. So it's a really good place to do this work. Now, the Swedes are very environmentally conscious, they always have been, and the Swedish government put a lot of resources into this facility at Umeå University. And the bottom line is, if we look at the right-hand picture here, what you can see, hopefully, is this is a large diesel Volvo engine, which is being run, and this is the exhaust, which is coming out from that engine, and it's going through this large pipe here, where the bottom line is we dilute down the exhaust such that it ends up being about 5% of the original that's coming from the engine, and that's what's coming through this wall, and this is the other side of the wall here, and into this exposure chamber where we've got this volunteer sitting on an ergometer, a bicycle, doing a bit of exercise. So when this engine is running, then the atmosphere within this chamber with this 5% diluted diesel exhaust is roughly what you would experience beside a busy road in the UK. And so what we were trying to do was to replicate the conditions of walking along that road, but in this chamber where we can control everything else, you know, the noise, we can measure all the pollutants, the particles, the gases, etc., very, very concisely. And then when this exposure is over, which would be a 1 hour or a 2 hour exposure at a certain diesel concentration, we could take this individual out and we could undertake some examinations to see how their body has responded to that challenge. And of course, this has to be a controlled challenge. So on another occasion, we would have this individual coming back on a totally random basis, and they would be exposed to just pure air, no diesel at all. And we would be comparing their response to the breathing pure air to the response breathing that diesel exposure. And we were able to do this on a whole range of volunteers. And this is a really, really good experimental design. So after the exposure, the individual would come out and they'd go into the clinical facility, which is also in this building. And that's where my Swedish colleagues, who are clinicians, would undertake a procedure called Fibreoptic Bronchoscopy. So they would introduce a flexible fiber optic scope down into the airways of the volunteer. And at the end of this fiber optic bronchoscope, there could be a small camera, which would allow us to look at the airway surface. And that's what they're doing here. They're looking at this television screen at the airway surface to see if it's inflamed, for example. Or there may be a small set of calipers at the end of the bronchoscope, which will take a little biopsy of tissue from the individual to allow us to see how the lung wall is responding to that diesel challenge or to that air challenge. Or it may actually have a little tube which we can squirt down some saline and wash the surface of the airway and then bring that back, that sample, and take it out and take it to the laboratory for analysis. And so here on the right, that's what you're seeing. This is a sample from this individual's lung. And what we're looking at is one of the cells, which has been captured in this wash and brought out. And this cell is called a macrophage. Now, a macrophage is a very important part of your immune system. It's there to protect you against any foreign material that comes into your body. For example, any bacteria or any viruses, it's there to defend you. And what it does this generally by eating up that foreign material, encapsulating it, and then taking it away from the lung to be dealt with. Now, what this macrophage has done here is, in this volunteer, is it's encapsulated the particles, the diesel soot particles, which have gone into the lung following this diesel exposure. And unfortunately, this is not a very happy macrophage. These vacuoles which are developing here in the cell indicates that this cell is beginning to die. So yes, it's done a heroic job of capturing some of the foreign material, but in doing so, it's led to its own death. And you can imagine that you have a certain number of these cells in your body and certainly in your lung, patrolling the surface of your lung. And if enough of these cells end up dying because they're eating diesel soot, then your ability to deal with other problems is massively reduced. And this is what we think one of the major issues is with breathing in traffic pollution. It just decreases your immunity in general. So we undertook a whole range of different experiments over a period of probably about 10 years, where we really helped to advance the understanding of what just simply breathing in that city air was doing to your body, and how your body was responding to it, and how, if you were doing this over many days in the week, many weeks of the year, many years in the decade, that this would end up leading to the development of diseases which we now understand from the epidemiological, the population studies, were linked to traffic pollution. However, we ended up obviously, being frustrated that this was all going on in these very set conditions in this exposure chamber. And really what we wanted to do was to understand things better in the real world. And around this time, we started thinking along these lines about actually using London as a polluted city as our laboratory. We already were running all the air quality monitoring in London, the LAQN. We were undertaking lots of project work. We were developing reports for the city governance, the GLA, etc. And so therefore we really wanted to do more work on the streets in London and use it as our exposure facility. And so it came to us, probably not surprisingly when you see pictures like this, but this is Oxford Street in London, one of the famous streets. It's a picture from about 15 years ago, but basically it illustrates very well that in a road like Oxford Street, you have two types of traffic. You've got red buses, which looks like a red train here, and you've got taxis and delivery vehicles. And all of these vehicles use diesel as their fossil fuel, or at least they did at this time. So what we have here is there's no private vehicles, there's no petrol vehicles. We just have traffic which is emitting diesel pollution. So this, and you can see these tall buildings either side. So this is actually an ideal exposure chamber, and it's full of thousands of people every year walking up and down it as they undertake their shopping. So what we developed was a process by which we could use the real world, and here we're talking about Oxford Street, as our exposure chamber. So what we have here is a real world exposure chamber experiment. We took people with asthma up and down Oxford Street for 2 hours. This is one of our students who's carrying a backpack, which is packed full of equipment, which is measuring all the pollutants which are present here in the air that people are breathing. On another occasion, we took them to Hyde Park, which is only 3 kilometers away. You can see it's a much more pleasant environment, obviously much cleaner. And this was their clean air exposure, as we called it. And when we actually looked at the response of our asthmatic subjects to either breathing in Hyde Park air, which is the green, or the Oxford Street air, which is the red, what we found was when we looked at their lung function, measured here as forced expiratory volume in 1 second, what we found was that when they were in Oxford Street, there was a bigger fall in the lung function, significantly different from that we've seen in Hyde Park. And even though it was just a 2-hour experiment, this decrease in lung function was maintained at least for the next 5 hours. And luckily, as part of this experimental protocol, we actually brought them back into the hospital the next morning, to do another measure of lung function. And you can see that even then, many of the individuals had got still decreased lung function. So this was something which just wasn't going away. It was staying with them over a period of time. And you can imagine if someone worked here, either in a shop or driving one of these vehicles, and breathing this in every day was not clearly good for their health. So having sort of got that type of experience in Oxford Street, we were more ambitious. We started looking at the impact of London's air on children's health, because there was worries about this coming from studies in California. So this is a map of NO2 concentrations in London. You can see it's really bad in the centre, but all the major road arteries light up. So this study was undertaken in East London in a number of schools there. Basically what we did was we measured the kids' exposure to NO2 in this particular study, either at where they lived or where they went to school, or the route by which they went to school. And what we found was, you can see here that this is a map of graph of annual exposure to NO2 at their London postcode home, and 40 is the magic number. We're not meant to exceed that, and you can see that about 85% of the kids here were actually living on streets where NO2 concentrations were exceeded. So if we then looked at their lung function, we find actually that a smaller lung volume in children was associated with a higher annual air pollution exposure. So these children were basically, their lung was not growing at the rate it should do. And this is also very important because your lung grows up to about your age of 18, at that which point it stops. Nothing a lot happens for the next 10, 12 years. And then you start to lose a little bit of lung function throughout life. So if these kids are reaching that stop point with a smaller lung, they're never going to catch that lung capacity up again. So it's really, really detrimental to their future health. We also got some of these children to give us a lung sample. Now, it wasn't an invasive one using bronchoscopy. It was using this exhale breath condensate approach, which gives us more of an upper lung sample. But in doing so, it still gives us some insight to what the lung was doing. And here's an example of some of the cells that we saw in that fluid that we got from those exhaled breath samples. And you can see here, very characteristic, this cell, it's full of diesel carbon, which the kid has breathed in that morning coming from their home to the school. Very similar in many respects to what we were seeing in those exposure chamber studies that we'd done back in Sweden. So the final bit of health information I want to give you is, again, another study from London. And what we were doing is we were looking at the incidence of dementia based on just health records that we got from GPs across London. And what we found was evidence of a positive association between where people lived and the air pollution and their risk of dementia. And the bottom line here was that if we split all the individuals up into fifths, into quintiles, those that were living in the highest quintile of NO2 exposure, they had a 40% increased risk of having developed dementia than those who lived in the cleanest quintile, so the lowest exposure to NO2. So again, very persuasive evidence that living in a poor air quality area had this long-term risk, and this time associated with this terrible neurodegenerative condition of dementia. So let's move on quickly to the second part of the talk. This is a shorter part. How's the UK doing outside the UK? How's the UK doing outside the EU? So I mentioned about the WHO guidelines. These are some of the numbers which were set back in 2010, the concentrations which should not be exceeded to maintain healthy life. let's look at PM2.5. The magic number was 10. For PM10, the magic number was 20. And for NO2, the magic number was 40. So you just remember those 10, 20, and 40. So what happens is the WHO reviews all the evidence, and then organizations like the EU will actually take a political decision on what they will set as the air quality limit value, the legal value. And so the EU did this following the 2005 WHO work. And here is the data from the EU air quality directives. PM2.5, the annual value, 25. Remember the WHO one was 10. PM10, annual value, 40. Remember the WHO one was half of that, 20. And for NO2, annual value, 40. Exactly the same as the WHO recommendation. So for NO2, the EU got it right, was brave, but for the PM, for the particulate limit values, they were very, very lax indeed. And the idea here at the time was that they had to do this because of the problems they had with air pollution in Eastern Europe, especially countries like Poland, where coal burning was still a major source of power generation and heating. Those sort of countries in Eastern Europe would never have a hope of obtaining these values under the EU directive. So they were set at a very lax level. Now, what this means, or what this meant at the time was, if we take these EU limits or target values, the EU was saying, and hence the UK was saying at the time, around 10% of people are experiencing harmful levels of PM2.5, harmful to their health. Whereas if you took the WHO guideline value, it's about 90% of the population is experiencing harmful effects for air pollution. For PM10, the EU was saying, well, somewhere between 70 and 30% of the population is having too much PM10 exposure, whereas WHO was saying, well, actually, it's somewhere between 60 and 83%. And if you looked at NO2, then not surprisingly, because the two agreed, they were in agreement, then 8 to 12% of the population were okay for NO2, exactly the same as the WHO guideline. So that's an illustration of how weak these guidelines were that the EU set, and that the UK was following until, of course, we went through Brexit. So only a few months ago, in September, October, the WHO actually updated their air quality guidelines. And here is a graph which shows how they've changed. So this is the 2021 air quality guidelines coming from all the latest health evidence that the WHO has reviewed. So for NO2, the 2005 number was 40, as I said. In 2021, it's been reduced to 10. Massive reduction, because we have all this new evidence to say that NO2 is really bad for your health, such as that data I showed you for the children's lung growth. For PM2.5, the number's gone from 10 to 5, it's halved. For PM10, it's gone from 25 to 15. So big reductions recently, and given that the European Union had very lax PM values from that we should adhere to and were legally binding, then the situation has got even further away from what the WHO is saying. So what's going to happen as a consequence of this? Well, the EU has responded, and it's taking up information around this. There will be consultations, and the indicative planning is that there will be a report in Q3 of 2022. And it'll be very interesting to see what the EU decides it can achieve in respect of its new air quality guidelines. The hope, of course, is that it's going to move substantially towards cleaner air. Now, the UK is outside the EU now, so what's the UK going to do? Well, as a consequence of moving out of and going through Brexit, the UK has introduced what's called the Environment Act, 2021 Environment Act. And this is a 250-page document, I've just pulled out a couple of comments for you around environmental targets for particulate matter. The Secretary of State must by regulation set a target for PM 2.5 in respect to the annual mean level of PM 2.5 in ambient air. Good, we're going to have a target. The PM 2.5 air quality target may but need not be a long-term target. Well, it certainly well should be. And then as you go down through these other ones, it's law gobbledygook really. PM 2.5 is the only pollutant which is actually covered in the Environment Act. So that's a little bit worrying. We have had some statements saying that there will be adherence to the EU limit values for the other pollutants, but of course, you know, we'll have to, it remains to be seen if that will really happen. And then secondly, what is the target going to be? How ambitious is it going to be? There was a lot of calls during this debate in Parliament as this act was brought in that we should be adhering to the WHO guideline value of 10, which has now been reduced to 5, of course. But there was a lot of opposition from government to that, because it's going to be a big task to actually achieve that. But of course, if we want best air for our population, that's really what we should be aiming for. So finishing up now, very briefly, is there any good news? Well, I guess, you know, I want to give you some before I finish. This is a picture of London in 1952, the Great London Smog, when we had these big power stations burning a lot of coal and causing terrible pollution in our cities across the UK. This is the same picture today. It's obviously now a very famous art gallery. This was the Bankside Power Station, which is now Tate London. The air is much better. It's not perfect, but it's much better than it was because we're not burning coal in our cities anymore. And this is all because of the 1956 Clean Air Act, i.e. an act of Parliament which banned the burning of coal in cities and in towns. And as a consequence of that, the two big pollutants that come from coal burning, smoke and sulfur dioxide, fell off dramatically over the next few decades. So I'm using this as good news by saying, yes, if we bring in appropriate policies, we can really improve air quality. And that's really what we need to do going forward. The UK has got really excellent scientific support. It's got this committee, which is mentioned in the introduction, COMEP, the Committee on the Medical Effects of Air Pollution, which regularly produces these reports. We have very good understanding of what the air quality problems are in the UK and what the impacts that's having on health. So there's no excuse in that respect. We just have to move forward with the difficult political decisions. And in that respect, it's really important that we have this improved understanding by politicians. Otherwise, nothing's going to happen. And again, I've got a good example of this in London, and that's the current mayor, Sadiq Khan, who came into power, I think it was 2015 or 16. And the day after he came into power, and one of his objectives was to improve air quality in London, because he's an asthmatic, his children are asthmatic, and he put this down on his ticket that he really wanted to try and improve air quality. A day after he came into power, he rang our office and one of his team said, can we have one of those thingamajigs that measures black carbon that comes out of diesel engines? This is him holding it in Oxford Street between two diesel buses. Well, this is a hybrid one, but this ethylometer measures the amount of black carbon that's in air. And he basically has stood by that ticket component where he's trying to improve air quality in London. He's introduced the ultra low emission zone initially just in central London in the congestion charging zone. Then in 2020, it went right out to the M25 for heavy duty vehicles. And then just a few months ago, it actually went out to the north and south circular, increased the size of the zone 18-fold, bringing in all forms of traffic. So it's really only the cleanest forms of traffic that can come into this area now, unless they pay a hefty fee. So that's a deterrent for older vehicles to be used in this area. He realizes it's not just private transportation, which is important, but also public. So the surface bus fleet, there's 8,000 buses in London. Most of the single deckers are now either pure electric or hybrids, and most of the double deckers are hybrids. And there's just been some successful trialing of pure electric double decker buses, which will only now be purchased in London as well. The famous black cab, 23,000 of these in London. The new TX5, which is an electric hybrid cab, which was available about 3 years ago. We now have 6,000 of these on the roads in London. So the numbers increasing all the time. We've got increased areas of pedestrianisation across the city. We're encouraging cycling and electric bikes use. Electric scooters, we're still having problems with. We don't seem to be able to think whether we're going to allow these on in cycle lanes or speed limit them or whatever we're going to do. But there are trials going on in cities across the UK. But all of these should ensure that the air quality improves, at least from a public transport point of view. What's happening elsewhere? Well, all major cities are having the same problems. Paris and London have been basically working side by side to try and introduce traffic calming, traffic improvement measures. Paris has now gone one stage of beyond us, because from the summer this year, Paris is actually going to ban what they call through traffic moving through the centre of the city. And this means that unless you're a resident in this area, you will not be allowed to travel through the city. You'll have to go round the central area. Otherwise, you'll receive a very large fine. In other cities such as Oslo, which actually Norway leads electric vehicle uptake in the world, basically, they plan to phase out fossil fuel vehicles, petrol and diesel vehicles, from the center of the city as early as this year. So, you know, these things are happening at a pace. And then looking forward, and I think this is my last slide, there's other problems coming up. Even if we deal with all the emissions from traffic, we've got non-exhaust particles from traffic as well, rearing its ugly head. And that's coming from tires, from brakes, and from road wear. We get a lot of particle production there, and that's not going to go away even with electric vehicles. And may even in fact get a little bit worse, because currently electric vehicles are heavier than fossil fuel ones because the battery's heavy. We've also got issues like microplastics. You hear about these in our waterways and in the oceans. Actually, we now know that they're present in the air. We can't see them because they are micro, they're small particles, and they potentially are entering our body through our lungs as well. And we don't know if they're doing any harm. One would suspect that they are, but we need to undertake the research to demonstrate that. And then we've got other things like wildfires, biomass fires, and unfortunately, domestic wood burning seems to be on the increase. And this also produces a lot of particles. And there's obviously going to be questions about whether this is really appropriate, you know, with climate change happening and with our need to improve air quality going forward. So hopefully that was informative, hopefully enjoyable, and I'll be very happy to take any questions you may have. Thank you.
Thanks very much indeed, Frank, for that authoritative and eye-opening presentation. I'm sure it's given us all our attendees some food for thought this evening, and I'm sure we'll start to have a few questions coming in on the Q&A. If I could start things off, Frank, of course, what the pandemic has essentially done is created a natural experiment for us in terms of taking vehicles off the roads. And I just wonder, has your team been able to exploit any of what's happened over the last couple of years in terms of, highlighting, some of the things that you've been talking about this evening?
Yeah, I mean, it's been a really interesting time for air pollution investigators, because we've had this, as it were, a natural experiment, which we would never have been able to, to have outside a pandemic situation.
Yeah.
So, yeah, there's been a lot of interest because we know that people were advised to stay at home. We know that People were advised not to travel. We all saw that roads were clearer, skies were bluer, birds were singing, etc. It was really interesting, actually, what we found when we looked into this. The first thing is that NO2 concentrations fell dramatically, and that's because of a lot of vehicle traffic was reduced. However, around the early part of the pandemic, we actually found that PM 2.5 concentrations were increasing while the NO2 concentrations were decreasing. And this is because of the advent of secondary particles being formed in the air around springtime, when we have got a lot of agriculture activity. So both, in the UK and coming in from our European partners, there was a lot of secondary pollutants, which was pushing up PM 2.5 concentrations. And then we took another step. We actually thought, well, people aren't going into work, they're not traveling, so they're not getting exposed to pollution during that commute, but they're staying at home. And like I was sitting in my kitchen for the first 6 months working away. And actually, we had a lot of other exposures which we would normally have through cooking and through cleaning that was going on in the house. So depending on what your nature of your job was, some people actually may have been exposed to more pollution, more NO2, for example, if they were cooking with gas during the pandemic, during the shutdown, than they would have been if it was normal life. So it's not straightforward, and we needed to look at it in many different ways.
Great. Starting to get a few questions coming in. That's great. First one is, should we wear a mask every time we cycle? What's your feeling on that?
So I think it depends where you're cycling. If you're cycling in a rural area, no. If you're obviously cycling within traffic and you know that there's a lot of emissions you're being exposed to, then, and you don't have any alternative, you have to travel at that time and you have to travel on the main roads, etc., then yes, I would advise you to wear a mask. Cycling masks are actually very, very good these days, especially the ones with activated charcoal filters built into them. I know they're expensive, but they do work really well. They won't totally reduce your exposure to particulates, especially ultrafines, but they will do a very good job. But again, it's as I said, it's horses for courses. It really depends where you are cycling.
Yeah. Why are Parliament against implementing environmental policies to the extent of cities such as Oslo and Paris?
I think partly it's because it will affect behavior. It'll increase costs of people who are commuting. If people want to stay in their cars, they're going to have to pay a lot more to enter those cities. Mm-hmm. And I think, is this policy going to win me votes? I think that's the bottom line. And part of the problem, therefore, is we need the public to be persuading the politicians that that's what they should be doing. And for that to happen, we need the public to understand what the problems are, and therefore, influencing those decisions in the future. And unfortunately, that goes round and round in many cycles before we see real response. We have had several mayors of London. Some of them have really taken this on board, and others have not. So it really depends on the political situation at the time.
Yeah, I know there are controversies in Manchester at the moment, I understand, in bringing in.
That's correct.
Zones, yeah. So, what precautions what other precautions can people potentially take at the moment? I'm not sure what context that's referring to, but
well, I think if you're commuting and you're in a vehicle, then just be aware that the vehicle in front of you is emitting a lot of pollution. Mm-hmm. And probably if it's heavy traffic, I wouldn't have my windows open. And if you have your vents open, have it on recirculation. Don't have have the pollution coming in from the vehicle in front. If you're at home, then just be aware that when you're cooking, if you're cooking with gas, or even if you're cooking with electric but frying, you're going to be producing, or making toast even, you're going to be producing a lot of particulate pollution. So do have You know, do you have the extractor fan on when you're cooking, or open a window? Likewise, when you're cleaning, it's actually very similar to the pandemic advice that we have at the moment. Have a lot of ventilation in your home if you're doing, you know, things which will lead to increased pollution reduction.
Yeah, I read somewhere that if you're walking on a pavement uphill, you should be walking facing the traffic coming down, because that could impact on.
Yeah, it's as simple as that in some cases. I mean, clearly, if you're walking, if for example you're walking a child to school, then you know, don't walk them along the busy route. If at all possible, go down a couple of side streets. You know, go through a park if you can. Likewise, if you're cycling, do that.
Yeah. How does air pollution lead to strokes, Frank? Is anything understood about that?
Yeah, I mean, it's the really big question has been for a long time now is, do these tiny particles which do enter our lung and go deep into our lung, do they go across the blood-air barrier and into our blood and into our circulation? There is a little bit of evidence to say that happens, but in fact, it's you know, as far as we can see, it's only a small proportion. But the way I think about it, and I think the way it really happens, is that these particles are carriers. They're like bullets which target the chemicals which are on the surface into our bodies. And then when they reach the lung, they enter a fluid which covers our lung surface. And I think the chemicals dissolve off, and then they easily transfer across into our circulation. And so what we're talking about is chemicals moving from the lung to other organs, like the heart, like the brain. And as I tried to stress early on, this isn't happening overnight. This is happening over years, and in some cases decades. And it's just a buildup of toxicological challenge to those organs.
Yeah, thank you. A couple of questions here, Frank. Can't there be an immediate diesel ban, as it's the worst particulate traffic pollutant? Any thoughts on that?
So again, that would be a political decision. It would be a very big political decision. It hasn't been taken because a lot of our commerce, a lot of the transport of goods around the country, you know, in heavy-duty vehicles rely on diesel. So that's the first problem. The approach that's been taken has been to try and stop the NO2 and the particles coming out from the diesel exhaust. And that has really happened very well in the last few years. We had Dieselgate back in 2016, where the motor industry was really caught out. But since then, they have really improved things. So that has been the approach the government has taken. And as in London now and in other clean air zones across the country, they're only letting the more modern diesel vehicles into those areas because they are the cleaner ones. So that's a political decision. They've decided not to ban diesel outright. They've decided to try and deal with it in those ways.
Thank you. How bad is air pollution caused by farming? You did mention that in your talk.
Yeah, so there's lots of different types of pollution, but if we take the particles which we think are related to the terrible health effects, then fertilizer is ammonium based, and that ammonia, when it's spread on the land, will, under certain conditions, it'll evaporate and it'll react with nitrate in the air, and you'll get ammonium nitrate. And the bottom line is, ammonium nitrate is not a gas. It coalesces into a particle, very small particle. And that's what we call these secondary particles. And actually, when we have high pollution events, it tends to be that it's not the city that's producing more pollution. It's the city's producing its normal amount of pollution from industry and traffic and whatever. Yeah. But it's also secondary pollutants coming in from elsewhere, often from farming. And that together pushes the concentration of particles up into a dangerous level.
Yeah. A couple of people have asked about pollution from aircraft. Could you comment on that, quantifying the risk from?
So that's an interesting question, because actually aircraft tend to only produce pollution which has an effect on us at ground level, where at takeoff and at landing. And of course, the airports tend to have runways which have large areas of parkland around them. So usually those pollutants are pretty well dispersed before they actually have any real impact on residents. When the aircraft is up, at altitude, then yes, of course, it's burning fuel. But again, the dispersion of the emissions are such that there's not a big effect on the areas below the flight path. So yes, aviation does produce pollution, but it tends to be very diverse in respect of its effects. It will be helpful if we can get rid of it, of course, in due course. But at the moment, it's not, I would say, it's not a major worry. It's not a major consequence in urban areas. There's much more important things to go after at the moment, because that is where, people are being affected most.
And if I could just broaden things for a moment, Frank, and thinking globally and climate change, what impact is that going to be having on air quality in the coming decades?
Well, it depends where we go with climate change and how net zero is operated. And the bottom line is there can be positive effects and there can be negative effects. So the negative effects are pretty obvious. As we have a warming world, and as we're seeing it increasingly, you've heard about these terrible forest fires and biomass fires.
Yep.
North America, Australia, Indonesia, across the world. These fires are producing horrendous amounts of pollution, especially for the indigenous people that are living there. And as far as I can see, and I'm not a climate change expert, but as far as I can see, the world thinks that this is only going to get worse as we go forward. So that is a real worry from a pollution point of view. The other area which is very worrying, especially for certain continents, and that is, as temperatures increase, more land is going to dry out and we're going to get less precipitation. And this is going to lead more entrainment of soil dust and desert dust into the air. And this is already affecting badly some of the Middle Eastern countries, where their deserts are expanding and there's more dust, natural dust. But this natural dust is actually traveling long distances and it's picking up other pollution along the way. So that is acting as a carrier as well. And then the final thing I would say is there's a real worry for people who have conditions like asthma, who are allergic to pollen, because again, as temperatures increase, then the pollen season is going to expand. It's going to start earlier and go on for longer. And the allergenicity, the toxicity of those pollen particles seems to be increasing because of they're finding themselves present in more oxidizing environments because of the nitrogen dioxide in the ozone, etc. So those are all negative impacts. The positive impacts may be if we can stop using fossil fuels, stop burning things, then of course we're producing less pollution, and that's going to be of obvious benefit.
Yeah. Someone just wanted to clarify an issue that they'd read that 20-mile speed limits and traffic calming humps can actually be bad for pollution. Is this true?
So again, it really depends on the vehicle and the situation. So if you look at the emissions of a typical vehicle, say a petrol family car, if you look at the emissions against speed of that vehicle, the emissions when the speed is very low are high, and then as this vehicle speed increases, the emissions will decrease. And then it'll go up, maybe as you go onto the motorway to 50, 60 miles an hour, what you start seeing is an increase in emissions. So there's a U-shaped emissions curve. Now, the magic spot where you're at the lowest emission for some vehicles is around 20, 25 miles an hour. For other vehicles, it's not there. It can vary. So that's why I think there is some confusion often as to that sweet spot and the 20-mile-an-hour limit. But generally, I would say that 20 is better than 30, and
Right.
certainly from a health viewpoint, an accident viewpoint, you're going to get a lot fewer kids and serious accidents happening at that lower speed than you will do at the higher speed.
Yeah, yeah. Frank, if you wouldn't mind taking one more question, that relates again to air travel and how safe it is to be inside an aeroplane in terms of the air quality.
So again, very, very interesting question. I've only flown once since the pandemic started, and I was as worried as my fellow passengers. I wore a good mask the whole time I was there. If you read some of the outputs from the carriers, then they will say that air quality is really, really good on planes. They have lots of air exchange, etc., etc. But I've also, I've read research reports where, pilots have experienced health problems over the years. So I think things have improved. But the bottom line is, we know that if you are in a metal cylinder for a prolonged period of time and you don't have sufficient clean air coming into that cylinder, then pollution concentrations will inevitably increase. So I think the jury's out on that one. We need more information, and we need more independent information.
Okay. Well, Frank, thanks once again for a really outstanding lecture this evening. That has been absolutely fascinating for myself, and I'm sure our other attendees. So I'd just like to bring in my colleague, Karen Edwards, for a moment, just to perhaps capture some feedback, if that's okay.
Hi, yeah. Let me just share my screen a second. Okay, so those of you that have been with us before will have come across the feedback system we use on Mentimeter. So if you're able to, if you've got another phone or another screen, you can go to menti.com and enter the code 42750563. Hopefully you can see my screen there. Okay. Can I just confirm with one of our panel that you can see my screen? Yeah, fantastic. Okay, we're getting some votes in now. That's okay. So yeah, first question, where are you joining us from today? It'd be really good to know where our audience are from. Okay. Great. Okie doke. Oh, okay. So Cardiff, Wales, and another rest of the world. So welcome to you. Okay. Second question: have you attended a lecture before? Okay. A few new people there. That's great to see. Great. And where did you find out about this evening's lecture? So Science and Health webpage, events webpage, a few recommendations from teachers. So I guess we have some school pupils with us this evening. Okay, why did you attend the lecture? Yeah, to be informed, to be inspired, to take part in a webinar. Great. Hopefully you've been very well informed by Frank this evening. And as a result of viewing the lecture, good to see that most of you saying your knowledge of the subject matter has improved. Somebody will take some further research. That's good. Hopefully we spiked your interest. Okay. Yeah, and then if you could just give your thoughts on this evening's lecture in 3 words. Great. Okay. Good to see. Interesting, informative, important, thought-provoking. Great. Okay, some great feedback there. Thank you. I'll leave that open for you to continue to add to that, and I'll just stop sharing my screen for the moment.
Okay, I think I'm back in. So yeah, thanks everyone for attending this evening, and most importantly, thanks once again to Professor Kelly for his outstanding presentation this evening. So just to remind you that we are back again next month when we have Dr. Dane Beccano-Kelly from Cardiff University, who's going to be talking about Parkinson's disease. So that's Thursday, February the 17th. Stay safe, everyone. Diolch yn fawr. Thank you very much. Nos da. Good night now.